Many times people come to me, they tell me that they are having acidity since years together, they have been taking treatment for it, but they are not finding any symptomatic relief. When we further examine them, they usually have some pain, mild pain in the right hypochondrium, and they usually, when we elicit their history, they tell that this discomfort is more after taking fatty food. Now we call this as functional dyspepsia. Now what is functional dyspepsia? The gallbladder, whenever you eat food, it should contract. When gallbladder is not able to contract, that will lead to bile stasis, that will lead to improper digestion of the fatty food, that will lead to discomfort. For these people, normally we get an ultrasound scan and we take the measurements of the gallbladder, and later on they are given good fatty food, and after fatty food intake, once again ultrasound is done to get the size of the gallbladder. Now if there is not much of a change in the gallbladder, that means gallbladder is not functioning. We call this as functional dyspepsia, and patients who are having this problem usually should get their gallbladder removed, following which their discomfort will definitely come down.